I think the AI agenda has to be supported by basic tools. So there's some great AI coming up around CRM, around revenue management, around DRG coding. There's great AI tools out there. However, your insurance, your funders are not keeping pace with that AI agenda. So if your foundational companies, like your insurers, etc., haven't kept pace with the AI agenda, then we get caught in the middle as hospitals, because we can't introduce something that's great from an AI perspective if the agencies that we're relying on to feed data to us isn't synced with that. There's no point. So the biggest challenge I would say that we have is the AI agenda and everybody else that needs to feed their data into it, keeping pace with that change.